when you think about what the biggest root causes are, some of the biggest things you're looking for, and you're seeing these patterns of this is causing the female hormone issues today, what are you seeing?
Well, not to be too generalized, but inflammation is the biggest driver, I think. When you look at things like PCOS and endometriosis and subsequently infertility, which is a lot of what the hormonal female issues are, inflammation is at the main culprit there. So then the question is, what is inflammation? For somebody listening, I'm sure your audience is pretty well aware of that. But like for most people, they think of like, I sprain my ankle, it gets swollen, it's inflamed for a few days and maybe a few weeks, and then it starts going back to normal. But chronic inflammation is this destructive, repetitive cycle, right? Like that we get caught up in. And so for a female, or for anyone listening, male or female, when you have inflammation, typically what you're going to start to have is higher insulin. You have more of this insulin resistance problem that develops. And for females with endometriosis and PCOS, high insulin is, in my opinion, the biggest driver of that. And again, there is a genetic component that can make you more susceptible to those types of problems, especially with PCOS, where you have more follicles in your ovary that are not being, they're not maturing to a certain point. So they start to get immature and they start to kind of create some ovulatory problems. But for a lot of women, the main driver of that is higher insulin chronically. And then, in my opinion, the driver of that is usually a high level of inflammation chronically. So that's what I see as like the primary driver for females. And then you add on top of it, the source of that inflammation can be, emotional stress, like having too much on your plate, managing too much at home or at your workforce, or having poor sleep patterns or circadian rhythm, under eating, like that's a stressor, over exercising stressor. So I always try to tell my clients, like, it's not just like you have, you take some curcumin, phytozen curcumin, like that's going to fix all your inflammation. It's like, well, what if the source is coming from what's happening up here, or like what's happening in your relationship with your spouse, or what's happening every night before you go to bed and you're watching, something on your phone, you're getting blue light stimulation, and then you're not sleeping as deeply that night. And then you wake up and you drink a bunch of caffeine, you maybe skip breakfast, you go to the gym, and then you go off and do your work. That's a huge source of stress and inflammation that I think drives not like a dysfunctional pathological state, but actually an adaptive state. And what I mean by that is when women have, let's say PCOS, what's happening is you're taking this progesterone that would normally help you to fertilize an egg, and you're creating androgens, right? Those androgens are going to be the result of that. And those androgens are essentially making you more male-like. And to me, that's actually an adaptive thing that happens by design to help you survive the stressful situation that your body thinks you're in. So making a baby is not going to be productive, but maybe having more androgens or testosterone will help you to survive whatever stressful situation your body thinks that you're in. And so again, I like to kind of give the body the benefit of the doubt more times than not, because about only 5 to 10% of hormonal issues are truly genetic, right? And so we have 95% of these things that are lifestyle, epigenetic type factors that are influencing how your genes are being expressed, but we can't always blame these hormonal issues on genetics. We just can't.
Yeah. I did a genetic test recently. I had my 5-year-old daughter do it too.
Oh, smart.
And it was really telling, most people at this point have heard of MTHFR. Okay. And it's a methylation, specifically looking at methylfolate and seeing how well your body converts into methylfolate, which is needed for methylation, thyroid function, a number of things. But there are so many other gene variants you can have. One that I used to see a lot in practice, still do today, is HLA, and that's really tied to your body being able to detoxify mold specifically. So a lot of times, there's about 24% of the population where if they go into a moldy building or home, it just keeps cycling through their body because their body isn't good at binding to it and releasing it. And but there's such great value in knowing, hey, maybe what gene variant do I have? And sometimes you just don't even need a test. You just know, hey, I took this, I felt better, or anytime around mold, I have a problem, and you just generally know. But yeah, genes are, as you and I have talked about so often, they have to be turned on. There has to be a switch there, and you can switch them back on or off based on, to your point, lifestyle, the things we're doing on a regular basis. Something else you said, it made me think of this when you were talking about inflammation being a big driver, and then what was causing that and related to insulin and then stress and those types of things. But there is in Japan, they operate, now this really started in their motor vehicle division.
Okay.
But they would say, okay, if there's a problem with a car vehicle, we're going to practice something called the 5 whys.
Okay.
And we're going to keep asking why until we get to this was the actual root of it. And so, for instance, with what you're saying, if you have a woman with endometriosis, maybe the first thing is, well, why does a woman have endometriosis? Well, there's inflammation of this lining. Okay, well, why is there inflammation of this lining? Well, it's because insulin is spiking.
Yeah.
Well, why is insulin spiking in this person in particular? Well, sometimes on blood work or looking at lifestyle. It's actually because cortisol. It's not you're eating too much sugar because your diet's perfect.
Right.
It's actually cortisol's high. Well, why is your cortisol high? Well, because you're really, really busy. And sometimes this is where we always end up with a lot of these conditions. Yeah. Why are you so busy all the time? Well, because I feel the need that I have to please people and say yes to everyone. And then it goes to childhood trauma because at one point in my life, my parents taught me that my worth and value was in how much I got done and checking off a task or something like that. But my point there is when we're doctors of root cause, we're looking at why. And the further you can get to the why, the bigger results you're going to see long-term with patients. And so...
Absolutely. Yeah. And I think I couldn't have said it better myself. But again, having that perspective in your mind, you would think, well, that's going to take a lot of time to ask those 5 whys and to kind of dig with your patient. But once you do, and if you do that up front and you prioritize that, like the amount of work that can be done, that can be expedited after that is exponential, right? Because now you're no longer like tiptoeing around like all these potential problems. You're actually getting right to the meat of the problem. And I think for practitioners, I'm not sure how many practitioners listen to this, like I can't express how important it is just to take some time to like ask. I've never thought of it that way, those 5 whys, but I think that's a perspective I've always taken. But that's so important to actually get to the true root of it. And it's not always just like, if you have mold in your house, you want to get rid of that. You want to get rid of the source of that stuff. Yeah. But how many of those people have, especially again, this is why I like working with women, how many women have been told that they're just little men? Like they're the same. They're just little men. They just have like smaller physiques. But the reality is, like in God's design, they're totally different creatures, right? Like women have the role of bringing life to this world and nourishing that, and men have this role of like protecting that whole thing, right? At least in my opinion, from a biblical perspective. And so, if women think that they're supposed to be little men, that they have to just like toughen up and like pull their bootstraps up by their bootstraps, they're gonna go through life maybe telling their body to like be quiet and like not listen to their symptoms and kind of just put on a facade of like, I may have this ovulation pain or I may have this severe cramping that's like actually debilitating, but I have to be tough. I have to be a little man and kind of like push through. And I have to kind of like overcome my own body's communication that's trying to communicate with me. And I think if we don't acknowledge what women are actually going through on a day-to-day or monthly basis, we're going to encourage this masking of their symptoms that then perpetuate the hormonal dysfunction that can exist after that. And I think men, especially as a husband, part of the reason I got into women's health was my mom and my wife, and then now that I have daughters, it's just made me even more passionate about it. But when you see, like for my mom, for example, she has an autoimmune disorder, adult onset Still's disease, that I think was, expressed after my brother had cancer. So her son had cancer when he was 14. He survived and all that, but it was extremely, very, very challenging. After that, my dad had several heart attacks, and he went through all the stress because he was working 80, 100 hours a week and trying to provide for everybody. And so my mom took on a lot of emotional stress and a lot of stress with taking care of the household, and she starts getting these symptoms coming out of nowhere, and it turns out it was an autoimmune condition. In hindsight, looking at it now, it's like it makes a lot of sense to me. At the time, it didn't make much sense to me at all. But the whole point of all this is that she took on all these extra responsibilities and worry and stress and anxiety and all these things of just trying to keep your son alive, that I think, some women just go through more than they're supposed to. Like they carry more weight than they're supposed to carry. And especially single mothers or women who are, working and taking care of the household, running kids all over the place and feeding them, all this different stuff. I think that's why God created, a husband or a spouse, a partner to like balance that responsibility out.
Take off some of the load.
Yeah. And women don't get that. A lot of women don't get that offload because I think they think they're supposed to be something that maybe they're not. It's like they're supposed to be able to take on all these responsibilities and just like tough it out. But the reality is when you tough it out, you're just inducing the survival mechanism that we're talking about. And I think this is where we see infertility. It skyrockets because why would your body want to make another human when you're trying to just keep yourself alive?
Yeah, I think there's something to that is that a lot of women are just trying to tough it out.
Right.
They're just trying to tough it out and do more and more and more versus sometimes do less or take a pivot of do something really specifically in alignment with what God's called you to do. And this is true for men and women. If we're operating outside of God's design and what he's uniquely called us to do. And it can be different for one woman versus another, one man for another. But I think that's an important thing. I think anytime you're operating in the lane that God's designed for you, there tends to be not always I was going to say the word ease, but maybe a peace of knowing this is where I'm supposed to be. This is what I'm supposed to be doing. And that's so life-giving. I want to talk about some other conditions specifically. So we talked about endometriosis a little bit.
Yeah.
Talk to me a little bit more about the root cause of issues like, in your mind, of hypothyroidism and Hashimoto's.
Yeah. Well, again, when you look at the research, 80% of autoimmune issues are autoimmune, or not autoimmune, hypothyroid issues are autoimmune driven, right?
Yep.
So autoimmune thyroiditis. And women are accounting for most of autoimmune conditions. I can't remember the stat. I think, do you know the stat off the top of your head?
No, but it's much higher. It's much higher.
Yeah. It's like, it's a ton. And so I think the big thing that really triggered me back in the day when I started looking at this was like, okay, why are women, proportionally more having issues with autoimmunity in general, not even just hypothyroidism, but autoimmunity in general? Like, why are women more subject to hormonal imbalances? And, why do women perceive stress 40% more than men? Like, these are all things that really got me thinking about how can I help women truly solve these problems instead of just like, hey, you have a problem, good luck dealing with it. It was like, I have to provide the implementation or help them implement this stuff to be successful. And so I need to understand like what challenges they face on a daily basis. But when it comes to hypothyroidism, you mentioned MTHFR. That's a huge connecting point. When you look at the inability to methylate very well or take in or essentially folate and use it for essentially creating glutathione and detoxing and creating energy, all these things are if you're burdened by mold, if you're burdened by heavy metals, if you're burdened by parasites, if you're burdened by just existing in a stressful world, if you don't methylate well, your thyroid is now, because it's a master gland, is having to compensate to kind of just keep you alive. And I think when we start looking at, obviously iodine deficiency can be a big role. It can also be a problem in thyroiditis, we're making it worse, but there's a balance there, especially if you protect your thyroid with selenium, and there's some good ways you can do that. But for a lot of women, I think if you look at the HPA axis, which is your, hypothalamus, your pituitary, and your adrenal glands, and then you look at your thyroid, they're all working in conjunction with each other. And so if the brain is interpreting this stressful environment and, again, trying to prioritize cortisol just to kind of get you through, naturally you're going to have some suppression of that T4 to T3 conversion. And it's going to, long term, it's detrimental. It's called hypothyroidism. Short term, it happens all the time throughout your day. Like if you were to look at a live, analysis of your thyroid, you will see it fluctuates all day long. And that's normal. But when you see a trend of TSH and T4 and T3 and reverse T3 and all that, you'll start to see that, we're trending in the wrong direction. That's becoming more, in a low functioning state. And in my opinion, again, it's protective. It's kind of like insulin resistance, where your body is like pushing back against the potentially benefits of insulin. If it's chronic, it starts saying like, hey, we can't keep doing this because we're not going to survive this if we keep allowing insulin to dictate. So we're going to become resistant to your effects. I think cortisol does the same thing. Like there's cortisol resistance. And so you start seeing that affect the thyroid. So a lot of women are in that state where there's deficiencies, there's environmental toxins, there's food sensitivities like gluten and dairy that can interfere with your thyroid, especially if it's autoimmune based. And then there's just the chronic state of circadian rhythm disruption and all that stuff.
The way you started that, and this is where I want to I want to piggyback on this, and that is that why do women have more autoimmune disease than men?
Yeah.
And I believe it's because women are more emotionally driven.
Yeah.
If you think about it like this, this is typical. If you're a woman or man, everybody listening here, you'll recognize this. I know for myself, Chelsea is thinking constantly. And sometimes when I get home, it's easier for me to just shut my brain off
Yeah.
and not think.
Yeah.
Right? I think about my mom and dad growing up. My mom was always thinking, always worrying, whatever. And my dad was just watching TV.
Yeah, we're waffles.
Or yeah, exactly.
they're
and so there's a lot more of that. And in Chinese medicine, it's known, and this is the reality in all of
Sure.
our scientific community as well, is that when you're worrying and thinking constantly, it starts to drain energy from organs. It's draining it's causing cortisol to stay up because you're having to be alert while you're thinking like that. It actually then impacts insulin.
Yeah.
So all those hormones are affected if you are worrying, analyzing, obsessing. If your brain is on more and you're thinking. So I think that's a major driver. I mean, one of the greatest things women can do is try and turn their brain off, go for a walk.
Yeah.
Play pickleball, do lunch with a best
something.
friend. Just really, because I think a lot of women, what's happened is, and you see a lot of women like this in your practice as well. It's like they have something scheduled from the moment they wake up to the moment they go to bed, and they're a lot of them, full-time mom, full-time chauffeur.
Right.
Sometimes they're working as well, making food. I mean, there's so many things, and their whole day's packed.
Yeah.
And so it's like there's just no downtime.
Yeah.
And so I think prioritizing rest and just doing things that you love, like scheduling peace just throughout the week, that'll get you out of it.